Good morning, a very good morning to delegates. This is Dr. Ankita Mahapatra. I am going to present on the topic BOMBILE, blast of mobile battery in living eye. Coming to introduction, the mobile blast injuries are increasing in recent times. This increase in incidence is attributed mostly to the usage of cheap, low-quality phones and battery, as well as the use of mobile phone while charging. Mobile phone suddenly exploding in the hand and after receiving a call. Hello.
Dr. Ankita, please go ahead. We can hear you.
Yeah. Mobile phone suddenly exploding in the hand and after receiving a call is causing disastrous consequences on the patient, family member, and society, physically, economically, and psychologically. Battery can explode when they are charged too much or too fast, shoddy manufacturing of devices, overheating, etc. Mobile battery blast is a highly underestimated etiology for severe ocular morbidity. So here I mentioned two cases which presented to us last year. First case is a 29-year-old male who sustained injury to both the eyes due to mobile phone battery blast while using the device being charged. The patient, this is the right eye and this is the left eye. So on presenting, the right eye had a hand movement positive with inaccurate projection of rays, and the left eye was perception of light positive with inaccurate projection of rays. And there was charring and few warning injuries of lid and adnexa. In the right eye, it was an open globe injury with limbal laceration from 3 to 5 o'clock with uveal tissue prolapse. And in the left eye, it was a central horizontal corneal tear involving both limbus with uveal tissue prolapse, as we can see here. So we did CT scan and ultrasound to rule out any intraocular foreign body, and we saw foreign bodies in the anterior chamber. So we went ahead with meticulous corneal injury repair with exploration and took out the foreign bodies. Then we took care of the uveal tissue prolapse under general anesthesia. Post-operatively, optimal steroid antibiotic cycloplegic administration was done. After 1 week of surgery, the patient had right eye hand movement positive and left eye perception of light positive with inaccurate projection of rays, and the patient was referred to vitreoretinal department. The second case was a 7-year-old male child presented with pain, burning sensation, and watering from both eyes following a smartphone battery blast. He was playing games when the mobile was in charge. As we can see, this is the boy with right arm fracture, and also he has some abrasion wounds on the abdomen and the left arm. And this is the eye status. On presentation, he had right eye 20/40 and left eye 20/60. Intraocular pressure was 15 and 16 millimeter of mercury respectively. Multiple charring spots on skin, few foreign bodies in the tear film and conjunctiva with no limbal ischemia was seen. So we went ahead with the topical anesthetic agent to alleviate the symptoms and patient cooperation. The eyes were washed with copious ringer lactate. pH of ocular surface normalized and debris removed. The fluorescent stain showed multiple superficial corneal epithelial defects with right more than the left, and the slit lamp biomicroscopy was normal. The double eversion of lids done to look for any chemical residue or foreign body, and it was not there. Intraocular pressure and posterior segment examination was normal. So as a treatment, we gave topical preservative-free lubricant and broad-spectrum antibiotic with topical cycloplegic. On 1 week follow-up, the patient was doing fine. The mechanism of injury from battery blast could be a combination of mechanical, that is the battery pieces flying into the eye, a thermal or chemical injuries. The present data on ocular injury by mobile blast is insufficient. Few case reports published from India had presented good outcome and timely and proper management of cases. So I found 3 studies. One is Narang et al., who showed a grade 1 ocular surface burn with multiple soot particles over cornea and conjunctiva. Ori et al., who showed 1 case of diffuse epithelial keratitis, and Kumar et al., it was a case series from India reporting severe ocular morbidity due to globe rupture with resultant vision or perception of light. Only one of the 4 eyes could attain the visual acuity of counting figure at 4 feet in the series. So for my conclusion, mobile blast injury is emerging as a new mode of ocular injury and can cause fatal blinding complications. As we know, prevention is better than cure. So adopting safer practices of using and charging cell phone according to the manufacturer, avoidance of overcharging and overheating, and public awareness about the downside of using counterfeit and cheap products should be there. These are my references, and thank you.
That was a nice presentation, Dr. Ankita.
Thank you,
So, which
ma'am.
type of chemical injury was do you expect in such patients where you get, mobile blast? Which
Ma'am,
type of chemical? What are
mainly
the
lithium.
consequence?
Ma'am, lithium ion battery is mostly used in phones. So I will expect that.
Okay. So, what about the, otherwise, how you take care of the chemical part of it, just the injury which happens because of the chemical thing which is there in the
We
eye?
did not get any chemical injury patient, but in case of chemical injury, we have to see whether it is an acid or alkali, and based on that, we have to go ahead with the treatment.
So these patients are basically it's a combination of mechanical and chemical injury,
Yes,
So
ma'am.
it's
And
a
thermal.
combined kind of thing patients
Yes,
have.
ma'am.
So we have to take care of each and every aspect of the injury.
Yes, ma'am.
In your case, what was the nature of foreign body that you saw? What was it exactly?
Ma'am, in the second case, we were able to see some metallic sheen, and we took it out from the tear film and conjunctiva, but I'm not sure about the type of the foreign body.
Okay.
Very nice case, Ankita. I have two questions for you.
Yes, ma'am.
Your second case was pretty clear-cut case, not much of a damage. But your first
Yes,
case,
ma'am.
how long was the follow-up?
Ma'am, actually, we did a 1 week for after 1 week, the patient came to us, and we actually on the B scan, we found retinal detachment and vitreous hemorrhage and all. That's why we referred it to a vitreoretinal department for further
What about the anterior
management.
segment in that case at 1 week?
Ma'am, the sutures were intact and it was not leaking.
There was no limbal ischemia, nothing like that.
No, ma'am. No limbal ischemia in that case.
And epithelium was recovered?
Yeah, ma'am. It was in recovery. We administered some normal topical
But
antibiotic and
after
lubricant.
1 week, you did not see that case.
Yes, ma'am. We saw, and there were still there were dry eye, and there was some patches of epithelial recovery, some
Okay.
infiltration.
Did his retina get settled?
Ma'am, I have not followed up
Yeah, so
after
after
that.
it went to the retina department, you have no idea what happened to
No,
that case.
ma'am. No,
Okay, the
ma'am.
second question what I want to ask you is in your literature study, did you find any such cases with good quality mobiles? Or these are all with the
Ma'am, all China made quality actually, MI or Micromax or that kind of phones, like cheap phones.
okay. Thank you, Ankit.